Okay, I'm Dr. Reiner and back from that small break. Thank you for tuning in tonight. And the first segment, we had Ray call in and brought up some interesting topics. Recently, along this line about the courts coming down on people, I had a recent conversation with one of the pharmacists in town who basically called me and told me that he thought a patient was being prescribed too much in the way of pain medications and that I was out of my scope of practice and he didn't want to fill that prescription. Again, I think everybody is kind of reeling from this intrusiveness into our government, into our personal lives. And again, it all stems from Walgreens doing this thing back in 2012-13 where they weren't looking at this 300% increase in the oxycodone that was being prescribed out of their distribution center. And the feds actually had a legitimate complaint against Walgreens. When your oxycodone goes up 300% over a period of time, you should be checking those numbers. And they should have known that there was an issue, and they should have done some due diligence. And all the feds were interested in is that you know your customer. And it's called good faith dispensing is what Walgreens has now termed it. Even with that, there's some loopholes in that. And so everybody's running scared that the DEA can come in and say, well, you should have known. And this you should have known issue is they're permeating the government. They're turning people against people, pharmacists against doctors, doctors against pharmacists, patients against that. And while they sit back, and I'm not sure what they're really doing, but you couldn't get a federal officer out here, a DEA officer out here to investigate any physician prescriptions unless there was over 2,500 pills involved or there was a Mexican surname. And I thought that was a little bit racist, but if you go to the DEA page on their home site and you look at the wanted people, there are a lot of Mexican surnames. So obviously there is some correlation between that, and I haven't investigated it any further, but I know that the DEA really did not want to investigate that. But on the other hand, they do look at pharmacies and they do penalize, and it is a way for them to raise money, $80 million. They charge Walgreens and fine them. Now, if you believe that Walgreens ate that $80 million and didn't pass it on to customer, you're sadly mistaken. I'm sure the cost of all the prescriptions went up to absorb the costs and they'll never come back down. So that's how you and I pay for that. So, good, bad, or indifferent, that is the world we live in. Anyway, one of the things I had started last time and I want to start back on again was talking about some of the vaccines that are available today. And the one that I think people should, these are vaccines that I think are important and people should look into. And shingles would probably be the #1 vaccine. Again, I talked about it a little at the senior center when I was there last Wednesday. It had to do with the fact that the shingles is a reactivation of the chicken pox virus. So if you had chicken pox, you can get shingles. And our body has a memory of that. And some person there asked about measles. Well, my age group and I think anybody after the age of born before 64, it might even be 57, usually had measles. And measles, live measles, meaning if you had the infection, you have cellular immunity, which you actually had the disease, and that is a very, very potent form of immunity. You probably will never, ever get measles again in your life as long as you are not taking immunocompromising drugs or going through cancer or chemotherapy. I don't know if that's true, but I know it is true for a lot of other illnesses. That being said, the vaccines that are out today are most of them are what they call acellular. They don't involve cellular immunity where they were created in egg and yolks and things of that nature. That being said, they are less likely to induce the immune response that you want. So that could be the reason why we've seen a resurgence in some of the pertussis. And there are people that never got the measles vaccine, and those people that had the measles vaccine may not have known that it had taken because they'd never been challenged with measles. So when you have people that come into the country that have not been immunized for measles, they certainly can carry it, they can get exposed to it, and they can spread it. And that's probably what you saw at Disneyland, because you got a crowded group of people. It took one person that came in that had an active measles infection and spread it to other people who basically were immune. Well, that can't happen with shingles. Shingles isn't transmitted that way. You have the ability to get shingles at any point in your life you've had chickenpox. However, if you've never had chickenpox and you're an adult, that's a very dangerous situation. And if you get chickenpox at that point, you can develop and the older you are, a varicella pneumonia, or a varicella is a virus, and that could be deadly. So one of the things you might want to ask your doctor to do, or your healthcare provider, is draw a simple blood test called an immunoglobulin, varicella zoster immunoglobulin, IgG, and that test will tell you if, number one, you've had chickenpox, and number two, how immune your body is at the current state at which time you get that. It's checking for the immunoglobulin, which helps to attack to that virus and prevent it from creating a problem. However, if that immune falls low and the antibody titers fall low, and you have some irritation in your skin or a sunburn or a rubbing, then the virus can grow. Anything that stimulates the nerve can allow the virus to grow. And the useful thing about that is the drug Zovirax, which is an anti-herpes virus, and I say that because shingles is a herpetic virus, meaning it is a virus that has a capsule, and that's how they define what the viruses are today, by the protein makeup of the capsule, meaning you have a protein surrounding, and inside you have some DNA or RNA, and that becomes the virus. So the shingles virus is a herpetic viral case. That doesn't mean it causes herpes, but it does cause herpes-like blister. If you talk to people that have a cold sore or genital herpes, they get a blister, it's fluid, and then it's very painful as it starts to heal. Well, chickenpox can do the same thing, cause a very diffuse rash on your body. Now, the reactivation of the shingles causes a very, very, very intense inflammatory response along a specific dermatome, and that's what is very hard to understand. But our spine cuts us in the middle, more or less this way, and nerves come out from the spine and go this way. They cross over a little bit in the chest wall, or the what we call the ventral side of the body, the anterior side of the body. There is a little overlap. So if for some reason you get this strange pain on one side of your body that you don't know how it got there, a burning, a searing, ache, something you can't explain, and it's on one side of your body, that's the prodromal before you actually get the rash. So if you talk to people who have cold sores, they will actually tell you that they feel something in their lip, or the tingling, the burning, they get hot coffee. Well, same thing is happening with the shingles. It's irritating a very large portion of your body. And most people blow it off. They may take an Advil, they may take something, and it may go away. But that should be a light bulb that goes off in your head. If just one area of your body is on fire and it doesn't cross over the middle, it's shingles until proven otherwise. And I've caught it a lot of times in my practice. People have come in and they've told me that complaint. I'll actually start them on the medication before they actually get the rash. And you may say that's a little presumptive, but the beautiful thing about Zovirax is it is only active in those tissues that are actually growing the virus. So it's really a non sequitur drug. It doesn't do anything unless the cell exhibits the actual herpetic virus. So it's a prodrug. It doesn't do anything until it comes in contact with it. So it's really a very safe treatment to take Zovirax if you think you might be getting shingles. Now, there are people who get shingles and they want to take Zovirax afterwards. Problem with that is that they're left with post-herpetic neuralgia, and that is a very, very painful situation because the nerve has been damaged, and it feels like they have a persistent shingles virus maybe for the rest of their life. And Zovirax is not the cure for that, meaning it's only a very short-term 5 to 7 day treatment to try and slow down the virus. But even though you do that, you can still have burning, searing of the nerves because the nerve has been damaged by the growing virus. The that being said, it's very important that you realize that the earlier the treatment, the better your chances of reducing what we call this post-herpetic neuralgia. And I'll define that for you. Post meaning after, herpetic meaning a herpes-like virus, and neuralgia being a chronic burning in the nerve pain. And some patients get a very severe outbreak, and they have very severe post-herpetic neuralgia. And with that being said, that's what you're trying to avoid by the shingles, meaning nobody dies from shingles, except if you're severely immunocompromised and you have cancer and it spreads into other areas. Yes, if it's on the face and it gets in the corneal nerves, it can cause blindness. In very rare cases, would it be disseminate into deeper organs. So I shouldn't say nobody dies from that. The usual case is that nobody should die from that, but I'm sure there are very severely immunocompromised people that might be a fulminant infection, and that would be an unfortunate situation. But that being said, that's very, very rare and very, very limited circumstances. And so when we're going to be going to break here in just a few more minutes, and then I have some slides I'll be trying to bring up, and we can talk about those. In fact, right before we go, we'll bring up, if we have enough time, we can bring up that herpes slide, but if not, we'll wait till after the break. And then we're going to talk a little bit after the break. We're going to go into the well, draw a blank there. But anyway, we're going to talk about the hepatitis B, and then we're going to talk about the new pneumonia vaccine. So we'll be right back after that break. Thank you.